My name is Janet Yale, and I'm the President and CEO of the Arthritis Society, and I also serve on the Executive Committee of the Arthritis Alliance of Canada. And I will be serving as your Master of Ceremonies this morning. Let me begin by thanking all of you for being here today. It's more than fitting, I think, that we gather for this launch here in Calgary, where so much of the national leadership on this cause has been located. Thanks also to Alberta Health Services for serving as our host here today at the McCaig Tower. Au nom de l'Alliance de l'Arthrite du Canada, j'aimerais vous accueillir la bienvenue ici ce matin. Nous sommes très contentes de vous voir en si grand nombre pour ce lancement si important. I'd also like to recognize the entire McCaig family for all they've done. The research center they've built here in Calgary is second to none. The McCaig Institute is a member of the Alliance, serves as our unofficial headquarters, and is home to many of our best-known principles. To Anne, who's here today in Maryland, we simply cannot say thank you enough. In that respect, I also should note that tickets for tonight's Music in Motion fundraiser for the McCaig Institute and the Alberta Bone and Joint Institute have sold out, which is amazing. So I'm looking forward to tonight. As you know, the Arthritis Alliance of Canada is a coalition of groups from right across the country dedicated to the prevention and improved treatment of arthritis. I hope you will agree that the breadth, the expertise, and the reach of our alliance is both impressive and unprecedented. We speak for some 30 groups, many of whom in turn represent dozens, hundreds, and even thousands of individuals. We are people living with arthritis and their physicians. We are physiotherapists, chiropractors, and occupational therapists, nurses, researchers, scientists, industry partners, community caregivers, and many more. We've come together to put in place a plan, a framework for progress and change that you'll find captured in the report that we're releasing today, and that my colleagues will detail for you in a moment. Above all else, we're here to send a very simple message. There is nothing inevitable about arthritis. Its march can be halted, its reach can be reversed, and we must dedicate ourselves now more than ever toward that goal. To talk more about this vital health objective and our plans to make progress, I'm joined this morning by several others, Dr. Diane Mosher, President of the Arthritis Alliance of Canada, Linda Wilhelm, who lives with the daily pain of arthritis, and Dr. Cy Frank from the Alberta Bone and Joint Institute. Each of them will speak briefly, and then we will turn things over to the media who are present to ask any questions they might have about the report. Before we do that, however, we're fortunate today to be joined by a representative of the Alberta government and legislature, Sandra Jansen, MLA for Calgary Northwest. Sandra.
Oh, it feels good to be here today, and thank you so much for the invitation. On behalf of our Premier, Alison Redford, I am so pleased to pass on congratulations to the Arthritis Alliance of Canada. I really would like to commend the Alliance and its members on the extremely valuable work that's been put into this joint framework. And it really does provide a relevant and meaningful tool for stakeholders across the country as they work to prevent arthritis, help arthritis patients manage their disease, and work towards finding new innovations and advances in treatment. And given that September is Arthritis Awareness Month, this is a very timely announcement. As we all know too well, arthritis is a chronic disease that affects many Canadians. I am one of those Canadians. I have arthritis in both knees and am actually not looking forward to, but expecting knee replacements within the next 5 years. My mother has had a hip replacement, is probably heading for another one in a couple of years, and has arthritis in both hands. We are a family deeply affected by arthritis. As you all know here today, Arthritis knows no boundaries. It doesn't follow any age, any ethnic background, any physical condition, or any other demographic. And here in Alberta, we should talk about the numbers, and many of you know these already. You're probably very familiar with these stats. In 2011, approximately half of Albertans over 70 years of age had some form of arthritis, and that translates into about 142,000 seniors. Also in 2007, and this was startling to me when I read this, more than 14% of Albertans aged 14 and over suffered from some form of arthritis, and that translates into 444,000 Albertans. Clearly, arthritis is a disease that, if it hasn't impacted each of us personally, it is very likely affecting someone we know. I want to say a few words about some of the initiatives the Alberta government has taken to help educate people about arthritis and how to treat it and even slow its advance. The Alberta government, along with its partners, supports the Arthritis Society of Alberta and the Northwest Territories in the delivery of an innovative program called Arthritis 101. This program is offered free of charge for anyone who's newly diagnosed with arthritis and for anyone who's looking for additional information about the disease. There is a 2-hour interactive program, Arthritis 101, and it's really built on the ABCs of arthritis. It teaches individuals about arthritis, about self-management, and about the importance of utilizing community resources, and there are so many. We are very lucky in Calgary. There are workshops available across Alberta and the Northwest Territories, and they're often facilitated by people who are arthritis sufferers. The program was developed with the support of the Alberta government after a 2008 survey identified a gap between the time an individual is diagnosed with arthritis and the time of the initiation of their treatment. Arthritis 101 has seen a significant success since it was launched, and the Arthritis Society has developed solid and effective partnerships for delivery of this program. We are very proud of our Healthy You campaign. It is a public information campaign that promotes the benefit of a healthy lifestyle for Albertans, and now it's in its 9th year and it's enjoying a tremendous success. One of the messages we're able to convey through the Healthy You website, which is www.healthyalberta.com, is really the benefit of physical activity to help manage osteoarthritis. So by keeping more active, a person can keep their joints moving and help prevent the disease from progressing too quickly. The Healthy You campaign also encourages weight loss, good nutrition, and helping reduce joint pain caused by osteoarthritis. So as time goes on, we continue to learn more and more about arthritis, and the joint framework we're going to be talking about today is certainly going to help in this endeavor. I would like to thank the Alliance once again and all their member organizations for all of the work they have done. It's been a tremendous amount of hard work, and we really want to recognize that. It is so encouraging to see such collaborative work, and for an arthritis sufferer like myself, I thank you deeply for that. Thank you so much.
Thank you so much, Sandra, for that heartfelt expression of support for the work we do. We certainly recognize that our efforts will succeed only if we're able to maintain and strengthen our partnerships with governments at all levels, and we're very grateful for the presence of Sandra here today, and as well Donna Kennedy-Glanz, MLA for Calgary Varsity. Do you want to just give a little, there you are. Thank you both for being here and for the ongoing work and partnerships we have with the Government of Alberta. So now we're going to turn to today's report and our proposed approach, and to share that with us, I'm going to call on Diane Mosher, President of the Arthritis Alliance of Canada. Diane.
Good morning. Thank you, Janet. As you've already heard, I am the president of the Arthritis Alliance of Canada, but I am also section chief of rheumatology at the Calgary Zone Alberta Health Services and a member of the McCaig Institute and University of Calgary. 25 years in this field have brought me face to face with the toll arthritis plays on the daily lives of so many Canadians, our parents and our children, our siblings and our neighbors. We're here today to do something about it, to move forward the cause of combating arthritis, of helping those who already live with its pain and preventing others from ever having to experience its cruel touch. With the release of this new report, Joint Action on Arthritis, a framework for prevention and care in Canada, we hope to mark a new milestone in this long struggle, and we hope to invite others to join us in this quest. Let me start by putting the problem in context. First of all, today, some 4.6 million Canadians are directly affected by arthritis, and that number grows when you include other bone and joint diseases. Arthritis is already our country's leading cause of long-term disability, but not only this, it affects every aspect of your life. Playing with your children or grandchildren, enjoying a walk in the park, a game of golf, participating in society. That is problem number one. Second, the number of 4.6 million Canadians is set to explode in the years ahead as our population ages, obesity rates increase, and physical activity declines. Within a generation, the number of Canadians affected will literally double, to the point where 1 in 4 of us will join the ranks of those suffering. That is problem number two. Third, as this disease debilitates more and more Canadians, extracting enormous physical and emotional costs, it also devastates budgets and our national productivity. In a study we released last year, we found the financial cost of arthritis is equal to a little more than $33 billion a year, or 2.7% of our gross domestic product. By 2040, without corrective action, that number will double and roughly be $68 billion. That's money that won't be available for other public needs, such as education, infrastructure, and pensions. Costs that will lower growth and drag our ability to create new jobs. That's problem number three. Fourth, a committed and complicated blend of governments, groups, and professionals currently interact to tackle the affliction of arthritis. They work in various ways to care better for those affected, to find new treatments to slow its impact, to develop techniques to prevent its spread, and to lend many forms of practical support that are needed so dearly by so many. But good efforts do not always translate into the greatest outcomes. We know, speaking as one of those intimately involved in this effort, that within the system there are gaps and disconnects, overlaps and oversights. Best practices are developed but go unshared. Tools are created but are not used, and that is problem number four. The reality is arthritis is not one problem, it is many problems, and without a concerted, coordinated effort to correct course, its impact will only grow worse. That is why we are here today, to call out to action all Canadians to join us in making the prevention and care of arthritis an urgent national priority. The good news is that this report also tells us how we can make things better. It outlines the ways in which we intend to advance that priority and make real progress. But before I turn over to my plan, allow me to first introduce someone else to give her story, to move our discussion from the theoretical to the practical, from a policy to personal experience. Linda Wilhelm is one of 4.6 million Canadians with this disease. She lives with its punishing limitations for more than 3 decades. She reminds us of why we're here today and how vital it is that we actually do better. So Linda, would you please come to the podium? Thank you.
Thank you, Diane. Seems like I've waited for this day for a long time. In 1980, I started experiencing some weird symptoms, just joint pain that would come and go, fever that would come and go, and just seemed like I'd have to stop living for a couple of days, and then it would be fine, and I'd go on with my life for a few more weeks, and then it would happen again. That was 1980. It was 1983 when I finally was diagnosed with rheumatoid arthritis. In the beginning, I had a family doctor who actually thought I was having some nervous problems and prescribed me Valium, which I didn't fill because I knew that wasn't anything wrong with my nerves. And then I went to see a chiropractor who said I had one leg shorter than the other. Finally, in 1983, I twisted my ankle, and it never got better. And I went to yet another family doctor who did some blood work, and the test came up with rheumatoid arthritis. At that time, I had a newborn baby and a 2-year-old. I was told to rest and ice my joints at least 10 times a day, which seemed to be almost impossible. So I just thought, well, I'll just carry on with my life and try to cope and manage the best I could. Then that went pretty much coping with remission coming and going until 1987. In 1987, we were in New Brunswick, and the disease came back with a vengeance. I didn't ever have another remission after that. After my 3rd child, I finally started taking disease-modifying drugs. And I started with Plaquenil, went to Cilazapyrin, Cupramine, Gold, and on, and until finally in 1998, I reached the end of the line, and there was nothing left for me to take. So I ended up in a wheelchair for about a year and waiting for the biologics, and went in the hospital in 1999 for surgery, and I stayed there for 3 months. I couldn't walk after the surgery. I couldn't go home. I had 3 children at home. I'd watched them for pretty much the last decade to try to help me. My daughter wouldn't go to school in the morning, didn't want to go to school because she had to dress me before she went to school, and she was worried when she left that what would happen to me while she was gone. So I just kind of drew a line in the sand at that time and said, there's some new drugs coming and I want to be able to try them. They weren't approved in Canada yet, so I stayed in the hospital until Health Canada acknowledged that rheumatoid arthritis was serious enough to allow me to access it, and 2 weeks after starting Enbrel, I walked out of the hospital. I got better slowly, but over a 5-year period, from 1998 to 2003, I had been rebuilt. I have 2 artificial knees, 2 shoulders, an artificial hip. I have ankle fusion, 2 cervical fusions, 2 wrist fusions, an artificial elbow, and you can just imagine, I think at one point we did try to cost out what the cost of all these surgeries, and we got over the figure of $500,000. So in a 10-year period, I'd cost the New Brunswick healthcare system over $500,000. I'd never been offered methotrexate until 1995. I didn't even know about it, and then later, as I became more educated and more empowered, I realized that methotrexate had been on the market for a great deal of time before 1995, and I wondered how many cracks I had fallen through. I think I fell through almost every crack and gap in the system that existed. It took me 20 years to assemble my healthcare team. I now have a wonderful rheumatologist, a wonderful family doctor, great orthopedic surgeons, physiotherapist who understands, occupational therapist, pharmacist, all these people now that I have coordinated, but I had to develop that team myself. In some centers in Canada, those teams do exist for people with arthritis, not in Atlantic Canada where I live in New Brunswick, and certainly not in many other areas. My outcome may have been different if I had had that team with me to support me throughout my journey. Added to that would have been really helpful to have had a good psychologist, psychiatrist throughout there. It's interesting, and my kids are all doing great now, and they're all growing up, and my life is a little easier because I don't have to, the laundry and the dishes and the meals and all that to think about as much anymore. I have wonderful grandchildren. I struggle to hold them. I'm doing well now on a biologic and with the surgeries. I can hold my grandchildren, and I am kayaking now, and my husband bought a motorcycle this summer, so we've been out motorcycling and just enjoying life. I feel empowered as a patient now. I didn't feel empowered in 1980, although I knew enough not to take the Valium. I didn't really feel like I had control. Now I think the internet has transformed the lives of people living with diseases like arthritis. We can get a lot of good information. We have to be able to weed through it and figure out what is actually good information and what is not so good information. But we can go into our physicians empowered, and it's our responsibility to know what treatments we have to, what our treatment options are and how we can best manage our disease and become a true partner with our healthcare team and know, when these people can really help us and know which one at which time can help us. So I'm really excited to see the launch of this framework, and I just can't wait for the next 10 years to see how care in Canada will improve for people living with arthritis, and that nobody else will fall through these enormous gaps and cracks in our healthcare system.
Thank you, Linda. Linda's story and many more like that really motivates us to do more. That we know now today that there's more than we could ever do in the past, and a coordinated effort is what we really need. But the question is, how do we do all of this? The answer is what we've worked so hard to develop among us. Each group and organization is part of the Alliance, contributing the benefit of its own perspective and expertise. And it's to be found in our report. It serves as a framework, a plan that provides a practical guide to achieving change and producing results. It begins with the inescapable truth that there is no one single answer, no one simple remedy. But it is also founded on the sure knowledge that with hard work, better coordination, and a common collaborative effort, solutions do exist and can be achieved. Our strategy rests on 3 pillars. First, we must advance knowledge and awareness about arthritis itself. It is not a natural part of the aging process. As we've seen today with both Sandra and Linda, it is not an old person's disease. It is clearly, Linda reminds us of this, there are countless myths that serve to frustrate the proper level of understanding and insight that is key to preventing and treating these diseases. We must boost awareness among the public and those living with arthritis and bone and joint diseases. We must boost awareness within employers, the at-risk and the at-play. We must help physicians and other healthcare providers who form the front line of this fight to do a better job of training and informing them of new developments and new techniques. We call for the enhancement and better alignment of research efforts. Compared to other chronic diseases, research investment in arthritis is modest. The Canadian Institute of Health Research, for example, invests $138.60 for every Canadian living with cancer. For arthritis, that number is $4.30. We must do better, from government funders, but also from the private sector. Finally, we'll need to benchmark and measure awareness so that we can track the impact we're having and connect it to better outcomes. The second pillar upon which our approach is based zeroes in on the practical task of improving prevention and care. The reality is this: simple awareness and education, we can do much. With simply that, we can do much to prevent arthritis and do more to those who currently suffer. If we can simply improve our ability to glean and gather what we already know and do and share it more systemically, we'll make a significant dent in the challenge before us. Dr. Cy Frank will speak next, and he's going to talk about the task of improving access and care. Our third and final pillar focus on enlisting the full range of partners and groups required to make true progress. As I have emphasized already, success requires that we all play an improved role. That means physicians, those living with arthritis, other healthcare providers, government, industry partners, and the general public. A collaborative effort is a better integrated effort, and the integration of activities and expertise is something that, at present, we are sorely short. So for a topic so confronted with challenge, today gives me great hope. We have managed to gather all the necessary parts and players. We have diagnosed the many problems that lay ahead, and we have created a strategy with specific goals and actions to make progress. I believe this is the beginning of a tremendously important undertaking, and I believe we will succeed. I'll conclude by emphasizing that we leave here with a focus on the pragmatic and will hold ourselves to account. You may ask, what comes next? What exact actions? What precise steps? I give you 4 specific goals we'll now concentrate our energies towards. 1, raising awareness of arthritis. 2, improving access to and delivery of the best possible arthritis care. Number 3, aligning and strengthening research dollars. And lastly, number 4, building ongoing stakeholder collaboration. It is as simple and as complicated as that, but we have the blueprint. The job now is to get the work done. I'd like now to introduce my friend and colleague, Dr. Cy Frank.
Thank you, Diane. Good morning, everyone. As Diane mentioned, my name is Cy Frank, and I'm the Executive Director of the Alberta Bone and Joint Health Institute. I'm also a very proud member of the Arthritis Alliance of Canada. I'd like to take a few minutes to focus on a subject that's vital to unlocking practical progress in our efforts against arthritis. It relates to the second pillar of the strategy that Diane spoke about, improved prevention and better care of arthritis among Canadians. It will strike many of us as intuitive that the best way to address the disease's burden is by preventing it from happening in the first place. Well, unfortunately, that's easier said than done. Nevertheless, we know where some progress can be achieved quickly and in relative terms efficiently. For example, obesity is one of, if not the primary, risk factors for the development of osteoarthritis. In addition to intensifying policy decisions and efforts to combat obesity as a matter of public health, just knowing this fact can help us better manage prevention. Earlier intervention and monitoring should allow us to make progress. We can equip physicians and others with the tools to help identify strategies to remedy and avoid arthritic developments. And we can lead people away from poor habits in earlier years that could lead to the onset of arthritis in later life. Another example is the importance we must place on education in the workplace. Injuries, even minor in nature, that are suffered on the job as well as during recreation will often blossom later into arthritic conditions. We know this. And consequently, we can better help patients take proactive steps during recovery and after to heal more thoroughly and mitigate further damage. So much of the answer lies in a massive and well-coordinated effort of research, education, and effective ongoing management at the community level. That is why the Alliance and today's framework is such a welcome and necessary development. It will also help us to identify and share leading models of care. This is vital to achieving practical results, both in terms of care and prevention. Together with my good friend and rheumatology colleague, Dr. Michelle Zoomer, they wrote Michael in the notes here. I co-chair Models of Care. It's aimed at the hard work and clear results of identifying, supporting, and disseminating the best approaches to prevent and treat all types of injuries and arthritis. Because we know without a doubt that the accumulation of evidence-based learnings will tell us all we need to know to deliver timely and more effective care. How does an arthritis sufferer first encounter the system? A GP or a chiropractor? With a question to their pharmacist or a visit to the emergency room? Where do they go from there? What, in reviewing comparable cases, have we learned about who does better and who does less well? About which treatments and referrals work best? Healthcare providers need to be equipped with this knowledge and evidence-informed care pathways with effective treatment algorithms so we can deliver a more reliable standard of care with a more consistent focus on excellence and results for the patient. Stories like we heard this morning should not be happening. There should not be gaps in our healthcare system that people fall through cracks and don't receive the appropriate care at the right time. That should not be happening in 2012. What I find most exciting about the approach brought forward by the Alliance is that it's a genuine bottom-up approach of working together. Individual healthcare providers and researchers are leading innovations, large and small, right across the country. The Alliance's framework will allow us to spot them, share them, put them in work for better of Canadians. I want to assure you that this can work because I've seen it work. It's working here in Alberta and actually across the country. I know this plan, the framework document, will help us sharpen our efforts to concentrate on improved sharing of models of care. That is the best care for all Canadians and the prevention of arthritis for all Canadians. In turn, that will help us deal directly with the challenges of better preventing and treating arthritis for today and for the years to come. That's why I believe that this framework and plan must be put into effect, why it must be treated as an urgent national priority. Thank you very much, and thank you all for being here today.
Well, thank you all very much for being here. That concludes the formal part of our day, but it does not, of course, conclude our efforts to attack arthritis with a coordinated, committed strategy and a renewed determination to make a difference. And that effort requires all of us to do our parts and play our roles. I believe, as we all do here today, that we can and will succeed. Merci encore une fois d'être venu ici ce matin. Thank you again for being here this morning. All of us who were speaking here this morning are available if there are media who have questions for us. And once again, thank you for your support of this incredibly important cause. Thank you.